Hello and welcome to this edition of the Wise Medical Minute. In recent months, we've had a fairly substantial influx of more male patients. And in the course of our practice, we do personal image enhancing services. More than 90% historically of our patients have been female. But one of our many services for the ladies has been hormone replacement therapy. And over these last 6 out of the last 9 years, in addition to the hormone replacement therapy we have done for the ladies, especially the postmenopausal ladies, not just them, but in rejuvenating these ladies and helping Stella get her groove back, we've had women bring in their husbands, and the positive response to male hormone replacement therapy is equally dramatic. So in a future video, I'm going to spend more time talking about hormone replacement specifically. But in the context of addressing male wellness in general, today's topic is more specifically oriented to treating erectile dysfunction. Again, I'm trying to keep my ladies happy. So the idea is, you have to have a multifaceted approach to dealing with this very common problem. Something in excess of 40% of men at one time or another, by the time they're 50 years of age, will have some degree of erectile dysfunction. And we are very successful with treating guys well into their 70s who have ladies who are still in their 30s or 40s. So age has become just a number. And many of you know that my 4th board certification was in anti-aging medicine. And I'm still working on that one. But the idea is my perspective as far as the hormone therapy is from that point of view. Now, the last thing I want to say about generalities before I get into the specifics is you always have to address the general medical conditions that are associated with the male performance issues. And I don't want to demean the significance of those as we talk about other specifics in the rest of this video. But addressing being overweight, addressing meds you might be on or need to be on for high blood pressure, and all those other general medical issues like smoking cessation, all that stuff's more important than the rest of what I have to say today. Now, in dealing with erectile dysfunction, the first thing I always advise is screening for low testosterone, okay? It's amazing how prevalent a low serum testosterone level is. And when we look at reports from the laboratory, they give you this wide range of normal values. So like with cholesterol, we've learned that we have to focus on what's desirable and not what's normal. Normal just means 2 standard deviations away from the mean. And that gives you a wide range of not so desirable numbers on the low end especially. So targeting your desirable testosterone level is probably the first step in addressing not only performance in the bedroom, but energy in general, the quality of sleep, addressing strength and endurance. All those things that are associated with age can be improved with hormone replacement, not to mention enhancing erectile function. Everybody's heard of the Viagra and the Cialis and the Levitra. All these drugs do have a role, but the class of drugs I'll refer to as a group, PDE5 inhibitors, they have a role, and sometimes that's all that's necessary for enhancing guys' performance. So that should be addressed early in the conversation. Too often overlooked when you use the PDE5 inhibitors is how they work. These drugs work by inhibiting the breakdown of nitric oxide. So if there's no nitric oxide around, they don't have anything to inhibit the breakdown of. So we always like to, early in the conversation, make sure people have a little bit of nitric oxide on board. Now, people have heard about L-arginine being good for your heart, okay? L-arginine can be converted from L-citrulline, which, both of these are amino acids, so almost no side effects in taking these supplements. But if you use high doses of the L-citrulline, as it's converted by your body to L-arginine, it gives off nitric oxide, okay? So having plenty of nitric oxide available is going to make the PDE5 inhibitor work better, okay? I like to dose it anywhere from 1,200 to 3 grams a day. And sometimes that's all we need to do. Moving on down the line, we have to include in this conversation the new so-called low-intensity shockwave therapy. The brand name that we have in our practice is Gainswave, but the concept is this percussive therapy, I prefer to call it, actually increases blood flow to the male apparatus, and basically with the idea being it creates a sort of healing response without causing an injury. And we enhance the healing response in lots of different ways, but no matter which other things you're doing to treat erectile dysfunction, the percussive therapy actually makes all of them work better. So I'm a fan and I do fully endorse the concept, but it's seldom the only thing that a guy needs to do. Now, when we're enhancing the healing response that's stimulated by the percussive therapy, one of the modalities that we have even more experience with is so-called P-shots or priapus shots, or again, they advertise these under lots of different brand names. I won't mention them, but the concept is PRP, which is made from your own blood. It's platelet-rich plasma is actually injected into whatever it is you're trying to enhance or make heal. So the priapus shot is a way to enhance that healing process that's stimulated by the shockwave therapy, or in and of itself can be a way to enhance the male apparatus. So we can't fail to include the use of PRP as a modality in enhancing male performance. I do want to mention 2 more things in passing. We talked about the importance of treating blood pressure. We talked about the prevalence of erectile dysfunction in guys who have diabetes, but we didn't talk about the importance of improving those things, because a lot of this stuff doesn't work very well if the diabetes remains out of control, or if you remain on the wrong medications for your blood pressure. There are alternatives that don't compromise one's function that can be used to substitute for whatever might be part of the problem. We also have learned that part of how people don't always get a good response to the Viagras and the Cialises is in part because of the lack of nitric oxide, but also in part due to the lack of understanding how these things work. So the psychological component of the male sexual performance is critical. And whenever I have the opportunity, I like to have the spouse or significant other in these conversations, because the PDE5 inhibitors, actually more facilitate a response to sexual stimulation. So if the sexual stimulation is not there, obviously they don't work. So usually women know what I mean when I say that. I don't have to do a lot of explaining to the wives, but the guys don't understand that for some reason. But that's as important as what you prescribe, that you understand what the drugs are doing. Last but not least, a lot of the benefits of the PDE5 inhibitors are a function of dosing. Okay, in other countries, you can get doses a lot higher than the available in the proprietary products in this country. So we've exploited that reality and compounding products that contain more than one PDE5 inhibitor. We'll have an ingredient that works quickly, its shortcoming is it doesn't last more than a few hours. We'll add a second ingredient that kicks in a little later, but will last almost a whole weekend. So the concept there is, if you have a little bit of extra nitric oxide on board, and if you have adequate dosing of the PDE5 inhibitor, which is easy to accomplish now that it's generic, but even easier in terms of response when we use a special compounded product to allow for better and more sustained response. And I believe I can say with confidence, in our experience with the compounded products, because they're dissolved sublingually in the mouth, we're seeing less of the side effects that limit the use of things like Viagra and Cialis. You know, the headaches, the nasal congestion, and those other side effects are much less common with the product that we invented. So in summary, to treat male erectile dysfunction, it's going to require a multimodal approach. No one form of therapy is going to be consistently adequate. All these things I've mentioned have something better than 50% success rate. And there are even additional modalities that now, with the advent of things like Gainswave injections, where guys give themselves a shot in the penis before sex, those things are becoming increasingly less common and less necessary because these other things are working better. But multimodal approach, multiple things, testosterone, optimized, right choice or right combination of PDE5 inhibitors, adding the nutritional considerations, including L-citrulline and other things, as well as the shockwave therapy, and addressing the psychological component. That's not a trivial consideration when it comes to this condition. So if you have other questions, I urge you to send them to me in an email. I'm old school. info@wisemedicalcenter.com, and I'll give you a response. And sometimes your questions stimulate topics for future editions of the Wise Medical Minute. Thank you for your attention, and thank you for making the wise choice.